right, Tim, thanks a lot. Well, in today's Health Check report, what if doctors stopped your heart and then couldn't get it restarted? That's the fear of a lot of patients as they undergo heart bypass surgery.
But there is an option allowing doctors to work on your heart while it continues to beat. Still, a new study suggests that procedure could actually lead to the arteries being reblocked again.
All right, my turn to say Happy New Year to Christy Myers.
Happy New Year, Mel.
Who joins us right now. Good to see you. To sort of sort out what all of this means.
It is rather confusing, and a study that came out last week has added to the confusion. Now, some studies say both procedures, the off-pump or on-pump, are equally safe. Other studies disagree. Now, the new twist to this pump or off-pump question, last week's study in the New England Journal of Medicine, which said the off-pump procedure, which proponents say has fewer complications, may not last as long. It found a bypass done off-pump may reblock faster, but doctors here disagree with that.
This is a suction-based device.
It's used to stabilize the heart. While a surgeon does a double bypass surgery on a woman's beating heart, he does not have to stop her heart for this surgery.
As you can see, the heart doesn't move as much.
It's called off-pump bypass surgery. Proponents say recovery time is faster and complications are fewer, and many patients like the idea of not stopping their heart. Dr. Mike Gomez with Memorial Hermann Memorial City does 97% of heart surgery off-pump.
Look at our results. Look at our data. In 6 years and over 1,200 cases, that it shows that our outcomes are dramatically improved.
Across town at the Methodist DeBakey Heart Center, they do most of their surgery on pump. The heart-lung machine was invented by Dr. Michael DeBakey at Baylor College of Medicine in 1953.
Off-pump cardiac surgery certainly has a place in very selected patients, but in general, the use of the heart-lung machine is such a great advantage and makes the procedure so much safer that it is quite difficult to give up this additional security.
A patient's blood runs through it, oxygen is added, and the blood returns to the body. The machine allows the surgeon to stop and start the heart.
It's quite complicated technology.
A New England Journal of Medicine study last week found the off-pump surgery was as safe as the on-pump, but other studies have shown that. But this study last week said that off-pump patients had a 10% higher rate of reblocking. Gomez disagrees with the British study, saying it was small, only 80 patients.
They use different medicines than we use here at Memorial City, and since the medicines we use here, we do not see that problem that they experience in that study.
2 years ago, Gomez said they changed to a different, stronger anti-clotting medication, and that made the difference in preventing reblockages.
You're doing fantastic, okay?
So if it sounds confusing, it is, even to the experts. Talk to your doctor if you're facing heart bypass surgery and ask about the off-pump versus on-pump choice. At Baylor, they say certain people are better candidates for off-pump heart surgery than others. At Memorial Hermann Memorial City, they say most people can do pretty well off-pump altogether. And as you can imagine, you'll expect to see more studies on this confusing study in the future, hopefully to sort it out. I think the key is get a good heart surgeon at a good hospital. Absolutely. You're probably going to be okay.
Yeah, that's best advice. Talk to your doctor.
Some people are squeamish about that video, but it's fascinating to watch
wonderful.
heart surgery.
You're watching surgery on a heart as it's beating, and all they did to stabilize it was put that little thing with suction cups there so they could have a little more stable heart. Or with on on-pump surgery, they stop the heart altogether as the pump runs the blood through, and they have a very stable area too to operate on.
Amazing. And it's done every day now. Yeah. Thanks a lot, Christy.
Well, school superintendents could